Section 5, Public Health Under Siege, the consequences of untreated STIs. The rise of antibiotic-resistant STIs poses a significant threat to public health. Untreated or poorly treated STIs can lead to a cascade of health problems, both for individuals and the wider community. The consequences extend far beyond the immediate discomfort and inconvenience of an STI, potentially impacting fertility, pregnancy outcomes, and overall well-being. One of the most serious complications of untreated STIs is pelvic inflammatory disease, also known as PID. PID occurs when an infection spreads from the cervix to the uterus, fallopian tubes, or ovaries. It can cause chronic pelvic pain, infertility, and ectopic pregnancy, a life-threatening condition where the fertilized egg implants outside the uterus. Moreover, some STIs such as syphilis can have long-term systemic effects if left untreated. Syphilis can damage the heart, brain, and other organs, leading to serious health problems years after the initial infection. The resurgence of syphilis in recent years, coupled with the emergence of resistant strains, is a cause for serious concern. Section 6. Tracing the roots causes of antibiotic resistance in STIs. The emergence and spread of antibiotic resistance are complex phenomena driven by a multitude of factors. Understanding these factors is crucial for developing effective strategies to combat resistance and preserve the efficacy of antibiotics for future generations. While the mechanisms of resistance are rooted in the biological world, the drivers of this crisis are largely anthropogenic. One of the primary drivers of antibiotic resistance is the overuse and misuse of antibiotics. Overprescribing antibiotics, often for viral infections that do not respond to these drugs, fuels the development of resistance. Similarly, using antibiotics inappropriately, such as not completing the full course of treatment, creates ideal conditions for resistant bacteria to thrive. Another contributing factor is the lack of new antibiotic development. Pharmaceutical companies have been slow to develop new antibiotics, primarily due to economic considerations. Developing new drugs is a costly and time-consuming process, and the return on investment for antibiotics is often perceived as low compared to other classes of drugs.